Okay, let's dive into this material you sent over. It's all about inflammation in the mouths of dogs and cats, stomatitis.
Right.
And at first glance, you might think, oh, sore mouth, maybe just, bad breath or some red gums.
Yeah, pretty common assumptions.
But these sources, they really show it can be much, much more widespread. Quite impactful, actually.
That's absolutely right. Based on this info, stomatitis isn't just gingivitis, that's gum inflammation.
Okay.
And it's not just periodontitis, which is deeper around the teeth supports. Stomatitis is defined here as widespread inflammation of the mouth's mucus lining.
A whole lining. Wow.
Pretty much. And it can even extend into deeper tissues sometimes. And there's a specific term you'll see, caudal stomatitis.
Caudal, meaning?
Towards the back. So significant inflammation right at the back of the mouth near the throat area.
Got it. And thinking about why the mouth, why is it prone to this?
Well, the pathophysiology described makes sense. The mouth has a huge blood supply, right? And it's constantly exposed. Everything they lick, chew, bacteria, viruses. It's sort of a perfect storm environment for inflammation to get started in that lining.
And here's something I found really striking in the sources. This isn't always just about the mouth cavity.
No, it really isn't. The effects can ripple outwards. Think about the pain. Severe pain can totally change how an animal behaves, especially with eating.
Makes sense. They wouldn't want to eat if it hurts.
Exactly. And anatomically, some mouth structures are close to the eyes, so severe inflammation could potentially lead to eye issues.
Huh. Didn't think of that connection.
Yeah, and if it's really bad, you might even see problems on the skin around the mouth, perioral issues.
So who gets this? Is it dogs, cats, both?
It affects both, yes. But these sources point out some interesting specifics, certain types or tendencies in particular breeds.
Oh, like what?
Well, for dogs, they mention ulcerative stomatitis seems to show up more in Maltese, especially males. And oral eosinophilic granuloma, that's a kind of inflammatory lesion. You see that more often in Siberian Huskies, maybe even hereditary.
Interesting. Any others jump out?
Yeah, gingival hyperplasia, which is like gum overgrowth, more common in large breeds. And then there's rapidly progressive periodontitis in young greyhounds and Shih Tzus.
Young ones, too.
Yep. And also localized juvenile periodontitis, often around the front teeth in mini schnauzers.
And what about cats?
We see juvenile onset periodontitis, which can definitely involve stomatitis in young cats, and then stomatitis linked heavily to calculus, that hardened plaque that's more typical in older animals, or breeds just prone to dental issues.
Okay, so let's picture this. If you're looking at your pet, what might you actually see? What are the signs?
Well, the signs can vary, but some are pretty common. Halitosis bad breath is almost a given and often really foul.
What?
Pain is a huge one. It can be mild sensitivity or it can be absolutely excruciating, makes eating really tough.
Right.
You might actually see ulcers, like sores. Tylism that's excessive drooling is common. Sometimes the drool is thick, maybe even bloody. You might notice swelling, edema, and like we mentioned, maybe some inflammation near the eyes. And inside the mouth. Usually lots of plaque and calculus. The worst lesions are often right next to the teeth with the most buildup.
But the sources do stress that just looking might not tell you the whole story, right? Like the specific cause.
That's a really critical point. Seeing those signs tells you there's significant inflammation, but it doesn't automatically tell you why it's happening. You need to dig deeper.
Okay, so let's dig into those causes. The list in these sources is, well, it's long. They call it multifactorial.
It really is. It shows just how complex oral health can be. The sources break it down nicely, though. First category, anatomic issues.
Like the shape of the mouth?
Exactly. Things like teeth being too crowded makes cleaning hard, traps bacteria, or issues with how the lip frenulum attaches, causing rubbing. Even breed things, like tight lip syndrome in Shar-Peis, can trap gunk.
Okay, anatomical makes sense. But then metabolic conditions,
Right.
like body-wide problems showing up in the mouth.
Absolutely. Things happening elsewhere can have oral signs. Uremia from kidney disease. Toxins build up. Ammonia levels in saliva get high and irritating.
Wow.
Diabetes can cause blood vessel inflammation, vasculitis, and dry mouth xerostomia, both bad for oral health. Hypoparathyroidism can lead to a big tongue, macroglossia, puffy lips. Even certain cancers, like lymphoma, can infiltrate the mouth tissues.
That's quite a range. What about immune-mediated causes, like the body attacking itself?
Yes, definitely a factor. Autoimmune diseases where the immune system gets confused and attacks oral tissues. Things like pemphigus, bullous pemphigoid, lupus SLE, and DLE, particularly in dogs.
Okay.
Even sudden drug reactions, hypersensitivity, can cause severe oral inflammation. And the sources specifically mentioned that caudal stomatitis in cats might have a big immune component.
Right, that's severe form in cats. Then there's infectious causes, bacteria, viruses.
Yep, but it's often secondary. Like, if there's already damage, the normal mouth bacteria can take over and cause infection.
Opportunistic.
Exactly. You can also get fungal infections. Systemic infections like lepto can cause little pinpoint bleeds, petechiae in the mouth. Feline leprosy can cause raised plaques. And viruses, oh yeah. Talcevirus, herpes virus are big ones in cats. Canine distemper, viral papillomas, warts in dogs.
Okay, infection. What about just plain trauma?
Seems obvious, but the list is varied. Simple irritation from plaque rubbing. Foreign objects, they mentioned gum shear syndrome. Things like thread or grass wrapped around teeth.
Gum chewer syndrome, right?
Yeah. But also more serious stuff, electric cord burns, chemical burns, cuts, snake bites, getting hit in the face, or even teeth hitting the wrong spot, like lower canines hitting the palate.
Ouch. Okay, and the last category was toxic.
Right. Certain plants, chemo drugs, radiation therapy to the head, chemical irritants, all can trigger stomatitis.
So with all these potential triggers, what makes a pet more likely to get it? What are the risk factors?
The biggest one highlighted is just poor oral health overall. Existing gingivitis, lots of plaque or calculus, periodontal disease that makes them much more vulnerable.
Makes sense.
For that specific caudal stomatitis in cats, they mentioned stress might be a factor, and maybe environmental triggers too.
Given this huge list of possible causes,
Yeah.
how on earth do you figure out which one is the problem? How's it diagnosed?
It's got to be systematic. You start by thinking about differential diagnoses, other things that could look similar, like different kinds of ulcers, or that specific condition CUPS, chronic ulcerative periodontal stomatitis,
Okay.
or bone issues like idiopathic osteomyelitis, even lymphoma. Then you need tests, blood work, urinalysis check for kidney disease, other systemic problems.
Right, the metabolic stuff.
Exactly, maybe specific immune tests if you suspect autoimmune disease, cultures for fungus or bacteria, virus isolation, toxicology if poisoning seems possible, maybe check protein levels, endocrine tests.
Imaging too, I saw. X-rays.
Oh, definitely. Radiographs are crucial. Check the teeth roots, the bone underneath, see if there's hidden dental disease driving it all.
But sometimes, even with all that,
Sometimes, yeah, you need a biopsy, a small tissue sample, especially to tell inflammation apart from cancer. That's often the definitive step.
this brings us to that really severe form mentioned in one source, feline chronic gingivostomatitis, FCGS.
Right. Also called caudal stomatitis because of where it hits hardest.
And this is different from the general stomatitis we've been talking about.
Very much so. It's a type of stomatitis, yes, but it's known for being incredibly severe, chronic, really painful, and it's seen almost exclusively in cats.
And the caudal part means it's focused at the back.
Precisely. Right where the palate meets the tongue base, those calodoglossal folds, and the area behind the molars, that's the hot spot for that intense inflammation.
And the sources suggest the cause of FCGS is really complex, right? Immune-mediated, but multifactorial.
That's the really fascinating and frustrating part. It seems to be this perfect storm. The cat's immune system basically goes haywire, overreacting to things in the mouth.
Like what?
Feline calicivirus is flagged as a major trigger here. Herpes virus might play a role too. Bartonella bacteria is sometimes implicated, though its exact role is debated.
What about FIV or FLV?
They don't cause FCGS directly, but if a cat has them, their weakened immune system can make the FCGS much worse. But the core issue seems to be hypersensitivity. The immune system attacks the cat's own tissues in response to normal plaque, bacteria, maybe viruses on the antigens.
So it's attacking itself, triggered by normal stuff.
Essentially, yes. And painful tooth resorption, where the tooth structure actually breaks down, that can also contribute to the inflammation and pain.
And the signs of FCGS sound absolutely awful, way beyond just red gums.
They are debilitating, the pain is intense. Cats often just stop eating or are extremely reluctant. They might paw at their face, drool excessively thick, stringy, maybe bloody drool.
Oh, poor things.
Anorexia, weight loss are really common because of that pain. The bad breath is usually severe. You see gingivitis, sure, but the hallmark sign is that fiery red, ulcerated, sometimes thickened tissue right at the back of the mouth, the caudal mucositis. The tongue can be inflamed too, glossitis.
So how do you confirm it is FCGS and not something else?
Well, seeing those signs, especially the caudal inflammation in a cat, makes you highly suspicious. But you need a thorough oral exam under anesthesia. Can't see back there properly otherwise.
Okay.
And then biopsy and histopathology, looking at the tissue microscopically, that's considered essential for definitive diagnosis. Crucially, it rules out other serious lookalikes, especially oral cancer like squamous cell carcinoma or eosinophilic granuloma complex.
And specific tests for triggers.
Yes,
Right.
recommended. PCR for calicivirus, blood tests for FIV and FeLV, maybe Bartonella testing,
Sure.
and definitely dental x-rays to look for tooth resorption or hidden dental disease.
Okay, now the second source mentioned this category of other forms of stomatitis. What falls under that umbrella?
That's basically everything else, all the stomatitis that isn't that specific FCGS profile. The emphasis there is that these other forms are usually secondary to something else.
Like the causes we listed earlier.
Exactly. The most common trigger for this broader group: significant dental disease plaque, calculus, periodontal issues. But it also includes stomatitis from foreign objects, chemicals, infections.
The viruses again?
Yep. Or that rare, nasty systemic calicivirus form, VSFCV, immune diseases like eosinophilic granuloma, uremic stomatitis from kidney failure, even oral cancers can present initially as inflammation.
In diagnosing those other forms?
Similar process, but the absolute focus is finding that primary underlying cause. So oral exam under anesthesia, dental x-rays, often biopsy is key, plus blood work and urinalysis to check for those systemic issues.
All right, so we've gone through causes, signs, diagnosis. Let's talk treatment. With such a massive range of causes, the approach must really vary.
It absolutely has to. The first step, generally, for any severe stomatitis is supportive care. Make sure they're hydrated, getting nutrition. If pain stops them eating, a feeding tube might be needed short term.
Okay.
And, crucially important, you have to address any underlying dental disease. Cleaning, treating infections, whatever is needed there.
Now for FCGS specifically, the sources really highlighted one major treatment strategy.
Yes, this is often considered the cornerstone for managing FCBS aggressive dental extractions. Frequently, this means removing all the teeth behind the canines and the premolars and molars.
All of them. Wow.
And often the canines and incisors might need to come out too. Full mouth extraction is very common.
Even if some of those teeth look okay.
That's the rationale explained here. Even seemingly healthy teeth are covered in plaque and bacteria. In these sensitive cats, that plaque acts as a constant antigenic stimulus, the trigger for that immune overreaction.
So removing the teeth removes the main trigger source.
That's the goal. By removing the surfaces where the triggers live, you aim to calm down the immune response significantly.
Okay, extractions are huge. What about medical treatments? Pills, rinses?
Medical therapy is definitely used, sometimes alongside surgery, sometimes as the main approach if surgery is impossible or for other types of stomatitis. Antimicrobials are common for secondary bacterial infections, things like amoxicillin clavulinate, clindamycin, metronidazole, doxycycline are mentioned.
And local stuff?
Yeah, chlorhexidine rinses or gels, zinc solutions, they can help control plaque and help tissues heal.
What about drugs to tackle the inflammation or the immune response itself?
Key players, especially if there's that strong immune component like an FCGS or autoimmune diseases. Anti-inflammatories like prednisolone or prednisone help reduce inflammation and pain, can boost appetite. They're mentioned for specific things like eosinophilic ulcers or as adjunctive therapy used alongside other things for feline plasma cell gingivitis pharyngitis.
And stronger stuff.
If it's truly autoimmune, more potent immunosuppressants like cyclosporine might be needed, or interferon alpha is sometimes tried. And if it turns out to be lymphoma causing the inflammation, then chemotherapy is the way to go.
There was a really important warning about immunosuppressants, though.
Yes, critical point. Don't use immunosuppressants if the main cause is infectious. Suppressing the immune system, then, could make the infection way worse. You have to know what you're treating.
Right. Any other treatments popping up in the sources?
Chlorhexidine rinses, as we mentioned. Omega-3 fatty acids are suggested as potentially helpful. And feeding tubes, again, if anorexia is severe. For those other forms, treatment really hinges on fixing the underlying problem, kidney disease, removing the foreign body, specific antibiotics for an infection, plus dental care and supportive meds like pain relief.
And once treatment starts, what's the follow-up plan?
Regular check-ins. Re-examining the mouth periodically to see how things are healing, if the inflammation is controlled, or if it's starting to come back, which can happen with chronic conditions like FCGS.
Can anything be done to prevent this in the first place?
Well, the sources focus on good oral hygiene. Things like weekly application of barrier products, or Vet was mentioned, on clean teeth to help reduce calculus. Regular brushing with pet toothpaste or using oral rinses, especially in animals already prone to dental disease. Basic dental care is key.
And there was one potential complication mentioned that sounded pretty serious. Bacteremia.
Yeah, that's when bacteria from the diseased mouth, especially with periodontal disease, get into the bloodstream.
And that can cause problems elsewhere.
Potentially, yes. The bacteria can travel to distant organs, kidneys, heart, liver, lungs. It really underscores that oral health isn't just local, it can impact the whole body.
So putting it all together, what's the outlook? The prognosis?
It really depends on the underlying cause. For FCGS specifically, the sources say it's variable. Many cats have a dramatic improvement, sometimes a near cure, with full mouth extractions.
That's good news.
It is. But some cats, even after extractions, might still need ongoing medical management to keep the inflammation under control. It's not always a simple fix.
Okay, so wrapping up this deep dive, it's clear stomatitis, especially that feline chronic gingiva stomatitis, is way more complex than just a sore mouth.
Absolutely. It's often chronic, definitely painful, and needs careful diagnostic work to figure out the why. And the management can be really involved, sometimes lifelong.
Hopefully going through these sources has helped paint a clearer picture for you, the listener. The different types, the huge range of causes, from teeth shape to viruses to the immune system itself, and how treatment has to be tailored. Understanding the potential severity and finding that root cause seems absolutely vital.
Definitely. And what really stands out, particularly with the feline version, is this incredible link between what's happening locally in the mouth and the body's systemic immune response. It makes you think, doesn't it? How much the mouth really is a window into overall health, into immune function. What other conditions might be driven or influenced by this complex dance between bacteria, viruses, and our own defenses, all playing out right there in the oral cavity? Something to ponder.